Chapter 18, Pain Management During Childbirth, Part 2. Opioid pain relief during labor will decrease the pain without loss of consciousness or sensation. Some of the common medications used are mepridine, which is Demerol, fentanyl, which is Sublimase, butorphanol, which is Stadol, and nalbuphine, which is Nubain. These drugs are given in smaller, more frequent doses. They provide quick pain relief but do not last a long time. As labor progresses, these meds tend not to work as well. They are given IV and should be given at the start of a contraction, so not as much of the medication will reach the fetus. Respiratory distress is a side effect that can occur, and it usually affects the infant if the infant is born when the medication is peaking. An opioid antagonist that may be given to reverse opioid-induced respiratory distress is naloxone or Narcan. If mom is an opioid dependent, then naloxone should not be given as it can induce withdrawal symptoms. In some cases, you can see adjunctive drugs being used to reduce nausea and anxiety. They can promote rest as well. Box 18.1 provides examples, doses, and notes on the systemic drugs. General anesthesia is a systemic pain control that causes loss of consciousness. It is not used routinely for cesarean sections anymore, as that medication will go right to the infant. It is reserved for women who cannot have spinal anesthetics or emergency situations. Adverse effects to mom include the risk of aspiration. Most women during labor are either NPO or clear liquids, so that risk is a little less. Respiratory depression can occur from the medications. Uterine relaxation is also an adverse effect which will put her at risk for a postpartum hemorrhage. Methods to minimize these adverse effects include keeping her NPO, giving meds to raise that gastric pH, and administering meds to increase gastric emptying. Respiratory depression in the neonate can occur since this medication readily reaches them very quickly. The best way to reduce this in the neonate is for the doctors will be standing over mom with the scalpel in their hand, so the second she's unconscious, they're cutting and quickly getting baby out. It's amazing to see how fast the doctors can work to get that infant out safely. Nursing care for pain management during labor include the assessment phase. Of course, assessing pain level is something that needs to be done. Watching nonverbal as well as verbals. You must also watch the EFM and assess for her contraction pattern and the fetal heart rate. Also, what is her preference for pain management? Has she had anesthesia before, and if so, what type and how did she react to it? Pain is the appropriate nursing diagnosis. Remember, many times you may not completely alleviate all of her pain. With an epidural, this is more likely than other measures, so you must determine what is an acceptable pain level for her. Ask her about that. It is okay if she's trying not to have a medicated birth for her to complain of pain with contractions, as long as she can tolerate that pain. Interventions can include encouraging relaxation. How can we do this? We talked about it before. Turn off the lights, limit visitors, that quiet environment, music of choice. Other interventions include reducing her fear and anxiety. You do this by keeping her updated and providing emotional support. Help her with non-pharmacological pain management if she's going this route. Of course, you then have to evaluate to be sure what you are doing is effective for her. If not, change what you are doing and proceed.